why we have demarcated a line between central nervous system and peripheral nervous system. We call brain and spinal cord CNS, and rest of the peripheral nerves exiting from the brain and spinal cord, peripheral nerves or peripheral nervous system. So why they have demarcated between these two? I am telling you from a physician's standpoint of view, because I see cases, right? So whatever cases we see, either if you take example of autoimmune inflammatory disease, let's take example of autoimmune inflammatory disease. So whatever autoimmune inflammatory disease affects brain spinal cord, it does not affect peripheral nerves. Like if we take example of multiple sclerosis, it affects brain and spinal cord, but it does not affect peripheral nerves. It spares peripheral nerves. If you take example of Guillain-Barré syndrome, which is inflammatory disease or immune mediated inflammatory disease of peripheral nerves, it does not affect central nervous system. In GBS you do not see involvement of parts of central nervous system. You see the peripheral nerves, like whatever the cranial nerves are exiting, those are actually peripheral nerves, right? So those are involved, but you do not see signs of involvement of central nervous system. So from nosological point of view, this pathophysiology of disease in central nervous system and peripheral nervous system is different. You cannot throw a steroid if there is autoimmune inflammatory disease in the nervous system. If you see GBS, a steroid does not respond, although it is acute immune mediated inflammatory disease of peripheral nerves, but a steroid won't help. In fact, data show that a steroid can worsen, right? But if it is the immune mediated inflammatory disease is chronic, that we call CIDP, in that case again a steroid will help, right? But if you see inflammatory disease of central nervous system, immune mediated autoimmune inflammatory disease of central nervous system, steroid definitely helps in acute process, and we give immunosuppressants for long term disease suppression, right? But in GBS we do not give immunosuppressants, right? If it is actually life threatening, like involving the respiratory system, right, then we go for plasmapheresis or we give IVIG. Otherwise we just observe, right, in cases of GBS. So in this way, from my perspective, this immune mediated inflammatory disease of central nervous system and peripheral nervous system is different.